These pills are dangerous, and if you're not getting it from your doctor, then you have a high chance of overdosing and potentially dying.
Now at 5, a drastic rise in overdose deaths spurs a serious warning. The danger of counterfeit pills in the community and the local school district losing students to the opioid crisis. Plus, the Johnson & Johnson vaccine approved for use again in Washington and Oregon. While some may still be wary, it's a step in the right direction for those working with the homeless. It's Sunday, April 25th. On this day in 1917, legendary jazz singer Ella Fitzgerald was born in Newport News, Virginia. The news starts right now. Good evening and thanks for joining us. I'm Brittany Folkers. Tonight, a stern warning that you have to hear. Cheap, fake opioid pills laced with fentanyl are leading to deadly drug overdoses across the metro area. As KGW's Mike Benner reports, this hits incredibly close to home for one local school district.
The last 18 months have rocked the Beaverton School District to its core. Superintendent Don Grotting says drugs and overdoses have led to the sudden deaths of several students.
Teenagers who had hopes and dreams and plans. These teenagers had families who loved them and are still coming to grips with their losses.
These families' unimaginable pain is beyond upsetting to local law enforcement and health officials, but sadly, not surprising. Tri-County Health Officer Dr. Jennifer Vines.
We are seeing an increase in fatal drug overdoses across the metro region, mirroring national trends. We believe counterfeit opioid pills containing fentanyl are driving this trend.
Dr. Vines says fentanyl is a man-made version of morphine, only much stronger, and the smallest amount can be deadly.
Anyone who gets pills from anywhere other than a pharmacy should assume that they are counterfeit and contain deadly amounts of fentanyl.
So just how dire is it in the Portland metro area? KGW has learned that so far this year, the West Side Interagency Narcotics Team in Washington County has investigated 14 overdose deaths. 10 of those are suspected of being caused by counterfeit prescription drugs containing fentanyl.
In the same time frame, 2020, we had investigated 3. In 2019, in that same time frame, we had only investigated 1.
Another indication of just how bad it is, in 2019, law enforcement in Oregon seized 79,000 fentanyl pills. In 2020, they seized more than 700,000 fentanyl pills, many of which were counterfeit.
They're sold on the street for as little as $10 to $15. It's incredibly potent and dangerous.
That's devastatingly clear in the Beaverton School District. Superintendent Don Grotting is begging parents to get educated and talk to their kids now.
It very well could be a conversation that saves their lives. This is truly an epidemic and we need to get ahead of it.
On Thursday, the Beaverton School District will be hosting a virtual community conversation about fentanyl. Among the scheduled speakers, a husband and wife who lost their son to suspected fentanyl poisoning in December. This conversation is sure to be heart-wrenching, but it is so important. You can find more information on our website, kgw.com. I'm Mike Benner for KGW News.
Portland police are asking for your help to find a driver who took off after hitting and killing a person on foot. Officers were called to Northeast 82nd and Alberta last night just after 11. When they arrived, they found the victim with deadly injuries, but they did not say if that person was pronounced dead at the scene or a hospital. No suspect information was released, but anyone with information is asked to call the police non-emergency line. A state of emergency is still in effect for the city of Portland until noon tomorrow. Mayor Ted Wheeler enacted it as a precaution to the reading of the verdict in the Derek Chauvin trial. He was convicted last week of the murder of George Floyd. Last night, the streets of Portland were clear of what the mayor calls a self-described anarchist group. And coming up on KGW News at 11, we're going to take you to a peaceful assembly at Pioneer Square today. Their goal, have a community conversation without violence. Now we turn to the pandemic. Oregon is reporting 780 new and presumptive coronavirus cases across the state and 1 new death. The number of hospitalizations is around 291, which is 4 fewer than yesterday. On the vaccine front, Oregon administered more than 25,000 doses yesterday. Now, Oregon and Washington are allowing the Johnson & Johnson vaccine to be given again. Our Galen Etlin looks at where the one-dose shot is available and who needs it most.
The Johnson & Johnson COVID vaccine is back on the table after more than a week of review by the FDA. Experts investigated 15 cases of blood clots out of nearly 7 million vaccinations. From Multnomah County's health officer last week.
This appears to be a really rare complication.
To an OSU and OHSU vaccine researcher.
By and large, people should go out and get those vaccines.
Experts have said the vaccine is safe, with both Washington and Oregon allowing it, with a disclaimer. As of Sunday, vaccinefinder.org showed most pharmacies are still not offering the J&J shot. In Portland and Vancouver, Fred Meyer, QFC, and Rite Aid locations offer it. CVS and Walgreens told NBC News they'll make appointments available for J&J in the upcoming week. Oregon Health Authority said for people who already got the shot, monitor any blood clot symptoms for about 3 weeks.
Anyone past this time frame is probably okay.
Ultimately, J&J's return,
really a game changer,
is welcome news to Scott Kerman at Blanchet House, which helps Portland's homeless community. He says only needing one J&J dose is a big advantage.
Because it would be extremely challenging with the community that we serve to get them back in 3 or 4 weeks.
Before J&J's pause, Blanchet House and Multnomah County were planning a vaccination event similar to this flu shot clinic last year. Now, planning can continue.
Meets folks where they're at, both physically and culturally.
Sam Young volunteers with Portland People's Outreach Project. It provides harm reduction services for the homeless and those addicted to drugs. You're on the front lines. What exactly are you hearing?
I'm hearing they want the vaccine. They want to be safe.
He says easy access is key, along with outreach and education to dispel hesitancy.
And to do so in a manner that's respectful and that recognizes the disparities and the kind of barriers that they face.
Blanchet House says COVID cases have not been too high in Portland's homeless communities, in part because shelters have provided protective gear. But since many on the streets have underlying health conditions, Johnson & Johnson's one-off vaccine could still make a big difference.
As trusted faces in the houseless community, that must go a long way as well in this conversation.
You know, I do think that the people that we serve trust us. It's really critical to their health and welfare.
Galen Etlin, KGW News.
India is struggling with a steep rise in coronavirus infections, but the U.S. is stepping up to help. India is setting global records for new daily cases. Just today, they reported nearly 350,000 cases. Experts say that number is likely underreported. Hospitals, have started turning people away, and they are dying on the streets. Many are turning to the black market just to get basic drugs in order to treat themselves and family members.
I have money, I have everything, but I can't save my sister because no bed, nothing like that.
As the tragic situation continues to unfold, the U.S. announced it will immediately provide raw materials for one of the vaccines, medical equipment, and protective gear to help the country respond. At least 82 people have died and 110 others injured after a fire tore through a Baghdad hospital dedicated to caring for COVID patients. Firefighters rushed to the scene to evacuate patients in Baghdad. Iraqi media is reporting the fire was started when at least one oxygen cylinder exploded inside the hospital. There were at least 120 patients in the facility at the time the fire began. Iraq is in the middle of a severe wave of infections, with daily rates now averaging more than 8,000 a day. The military in Indonesia confirmed they've found the wreckage of a missing submarine, and all 53 crew members on board are believed to be dead. The grim announcement came after the country said the sub was considered sunk. An underwater robot equipped with cameras found the vessel in at least 3 pieces. The cause of this disappearance, though, is still uncertain.